There's no shortage of scenarios, whether it's geopolitical stuff, whether it's natural disasters, any number of things. Our pharmaceutical supply chain is just on a razor's edge when it comes to how fragile it is.
I think it's important, especially nowadays with what's going on right now and this whole potential decoupling of East versus West.
We can say virtually all of the active pharmaceutical ingredients in those generic medications come from overseas. And the two biggest suppliers are China and India. So you're talking about potentially millions of people who all of a sudden need to be given this life-saving medication. Based on my past experiences and all of ours, maybe collectively in the last few years, we could see how that could quickly turn ugly.
Hi folks, Canadian Prepper here. So we have a special guest on the channel today. This is somebody who pioneered a service that I think is very, very vital in the preparedness community. It's something I think has been a long time coming. And when this company first approached me a few months back, this was a no-brainer. And as you guys know, we are very selective with respect to who we allow to advertise on the channel. We only promote stuff that we ourselves use, which makes for a very exclusive range of products and services that we're ever going to, put in front of the camera. And this is one of those things. So stick with us, guys. This is going to be a great episode. We got Dr. Sean Rowland here from the Jase Medical Company. He's going to talk all about the service, what they offer, how you can get an emergency stockpile of medication. So Dr. Sean, Dr. Rowland, I'm not really sure what we're going to call you again. Maybe just maybe we got to give you some kind of nickname or something. Dr. Prepper, how about that?
That'd be a new one. I haven't been called Dr. Prepper before, but hey, anything you like, I'm easy.
It's not trademarked yet, so you might want to pick up that web domain while you can. But yeah, how are you doing, man? And maybe tell us a bit about the service that you guys offer.
Sure, happy to. Very excited to be here with you. This is something that we're very excited about, something that we take really seriously, and so we're excited for any opportunity to talk about Jase Medical. So Jase, I mean, it's pretty simple. We offer emergency use medications through a quick and convenient telemedicine process.
I know, in the past, people have had to rely on like home remedies, various types of other antibiotics, which, may be a little questionable in terms of the source. And so to have something like this is absolutely beneficial. So, I mean, I know for me personally, like antibiotics are up there, like that immediately bumps your first aid kit up a few levels in terms of your capabilities. So what are the benefits? I mean, for people who don't really know why antibiotics are so vital, and why did you create this service in the first place?
The reason is, you have your food prep, your water, all the other things that, that we talk about when it comes to preparedness. Antibiotics specifically, you could have all the food in the world, you could have all the clean water in the world, but if you get an infected cut or any number of different things that could come up in an emergency kind of scenario, none of that stuff's going to matter. There's truth behind all the zombie apocalypse movies. There's the obligatory scene where some character in the show needs to go to break into a pharmacy somewhere and find their life-saving medications to treat stuff that what we really take for granted nowadays. And that kind of gets into a little bit of the history of antibiotics. It's in the grand scheme of things, when we talk about modern day medicine, it's been about the last 100 years that we've had access to these kind of medications. Before that time, the top killers easily in the world were all related to bacterial infections, whether it was pneumonia, whether it was sepsis, kidney disease, any number of different bacterial illnesses. That's what killed people day to day. Fast forward to today, and it's just something that we've grown accustomed to. We can treat all these things relatively easily with oral antibiotics. So if you think, what would happen if we were to remove some of the things that we have easy access to nowadays, and if we took a step back into some of those times where we're getting an infected cut or getting a UTI that was left untreated and got into your kidneys, were life-threatening. So that's why they're important. How Jase came to be, that goes back. I mean, we're a new company, right? We've been around. We were founded in 2021, kind of mid-pandemic. But the roots go back a little further than that. I was a resident physician practicing border health on the southern border here in the United States. And this was pre-pandemic, just a regular community hospital. We would have these meetings every day where the pharmacist would come in and let us know what supplies or medications might be in short supply. And I remember being just really struck at that time where we had, these were vital antibiotics and other medications that we used on a daily basis that were either in short supply or not even available. That was something that really got the wheels spinning in my head and made me wonder, what's going on here. And then fast forward to, the pandemic, we're in the middle of it. And that's just where it all came together. And I was starting my own private practice as a new physician. And for the first time, I had access to the costs of these medications. When you're, as a physician working in an insurance-based fee-for-service system, you're far removed from, I might have had an idea what it cost the patients, but I had no idea what the actual cost of these medications were. So getting into that and learning that these medications were really accessible cost-wise, compound that with knowing that our pharmaceutical supply chain is just on a razor's edge when it comes to how fragile it is. That's what gave me the idea that really someone needs to put these two things together and find a safe way to provide these medications to everybody, to empower everybody to be able to have access to something that is this vital and important.
Absolutely. And this is something which is invaluable when it comes to a survival situation. Because like you're saying, this could be the difference between life and death, really. I mean, a lot of over-the-counter medications, they can kind of help alleviate symptoms. When it comes to antibiotics and when it comes to a technological regression, as I call it, with a societal collapse scenario, whatever, even if it's only a short-term disaster or whatever the case might be, I mean, you're talking about going back to very rudimentary, primitive ways of administering medical care. And as a result of that, you're not going to have the tools necessary to deal with these issues. And having that just one pill, well, not one, but a bottle of pills, whatever you would take to alleviate the symptoms or whatever, is absolutely vital, especially considering in these disaster type situations. Even if it's like a flood or whatever the case might be, you're probably going to be doing physical stuff which is putting you at risk of injury, like you said, even a cut or a scrape. Maybe you got shot, stabbed, wounded in some way. So there's just the likelihood of needing something like this, or somebody in your party needing something like this, is almost 100%, I would say, on a significant enough timeline. So it's just a no-brainer to me, which is why, this has always been top of mind with respect to, getting something like this in my medical kit for sure. So you said that you obviously have a medical background. Now, I was pretty impressed when I went to your page because it shows Harvard, Yale, Mayo Clinic. So all these people who work with you, all the doctors who work with you are obviously accredited. And so you've established a decent team to kind of help you administer this whole process.
Yeah, absolutely. That was something early on, being kind of at the forefront of all of this. We wanted to make sure that we were doing it as safely as we could. And so that was one of the priorities. I wanted to seek out people who had experience, were leaders in their field, and kind of got what we were trying to do. And we were really fortunate to get some, as you mentioned, some incredible talent and from various institutions. They serve as advisors, we have our clinical advisory board. So they're helping establish policy, helping, writing our antibiotic guidebook. And as we kind of go forward here, we hope to be able to partner with local emergency preparedness government organizations and outreach. And so they'll be vital to do all that as well. But certainly they're an incredible resource.
Yeah, because a lot of people, when they hear about a service like this, especially preppers, because we tend to be quite skeptical of things, And, reflexively, people are like, oh, this must be some kind of scam, or these real doctors, and yada, yada, yada. And it took me, a while to kind of get people comfortable with this idea and making my own videos of it, and assuring people that, I've communicated with yourself and other MDs in the field who are, attesting to this. I've used the service myself. I know that it's legit. You can't it's not as simple as just ordering it online, but it's also a very smooth, streamlined process, which is incredibly easy and surprisingly fast. That's what I found, is that it wasn't like a whole lot of waiting. Everything is really easy to set up. You maybe have to put an app or two on your phone to kind of help expedite the process with the pharmacy and stuff like that, but easy peasy. So I was very impressed with just how fast, the whole process worked. Now, you just stated prior that most antibiotics, that there's going to be a limited supply as a result of supply chain. And I think it's important, especially nowadays with what's going on right now in this whole potential decoupling of East versus West. Now, I notice on your website, it talks about how the majority, I think is it 80% of medications come from India. And then of those 80%, the constituents of those come from China. Is that how it works?
So if you to get to specific percentages gets a little tricky, because it turns out, to no one's surprise, the pharmaceutical industry as a whole is pretty opaque. But a little bit of history there. So in the United States, the estimate is that of all the medications prescribed in the United States, 90% of them are generic medications. So that's all of your antibiotics, the majority of your chronic condition medications. So 90% of the medications prescribed are generic. And it turns out that of those generic medications, we can say virtually all, and that percentage might be 90, somewhere between 90 and 100% of all of the active pharmaceutical ingredients in those generic medications come from overseas. And the two biggest suppliers are China and India. There's other countries that are involved as well in other parts of the world. And you could probably even argue that China makes up the bulk of when you split up China and India.
That's actually kind of scary, because you're talking about 90% of medications. Some of these medications are going to be chronic medications that people rely on. If there was ever some major severance or disruption in the supply chain. Your service right now, you're currently offering antibiotics, but in the future, there's a prospect to offer people's other chronic medications. Now, I'm going to assume that not all medications are going to be able to be delivered in this manner, but tell us a little bit about, the prospect of actually prescribing chronic medications in addition to the antibiotic medication.
Sure. Yeah. So as far as disclaimers go, obviously I'm a physician, qualified to speak about all this, but not qualified to make comments on anyone's individual circumstances. Those would absolutely best be handled with their physicians. But I'm happy to give general information. Speaking about the chronic medication portion. So this is for those people who take chronic medications, is equally as, and for some of them, maybe even more important than antibiotics. These are medications that they take daily, and for some conditions, it's what keeps them alive. You mentioned maybe not all medications might be appropriate for this service, and that's true. And that gets to part of why we started with antibiotics and are working on the ability to offer chronic medications, I guess I would say, at scale. So for anyone that wants to come to the site. And so it's definitely a more complicated, it's more nuanced, but certainly something that we've found a solution for, and we're in the process of implementing. Really excited about it. And that's kind of the same process I mentioned with our advisory board, and getting a group of doctors together, talking about, okay, what are the most common conditions that we see? What are the ones that aren't so common? What are the common meds? What do we need to know to safely provide someone with a 6-month supply, a year supply? Because that's different information than we needed to have to safely prescribe the antibiotics, for example. And so that's something that's just around the corner as far as implementing that capability on our website. Super excited about it, though, and will make a big difference to those people's peace of mind, which was really, it comes down to having the peace of mind that you have what you need. And that you're prepared for any eventuality.
Yeah. And some people will say, well, I can just go to my doctor and, get these, but then you got to go through the whole rigmarole of explaining why exactly you want something like this. And, going to talk to your doctor is not the most, depending on how well you know them, it's not the most pleasant of experiences for most people as is. So having to, try to justify why you might need a 6-month supply worth of medications when you can just go to this service, which is there for that particular purpose. I mean, that's, I think that's a big selling point.
Yeah, no, you really hit on it. It's the convenience, right? It is so much more convenient to do it this way. And when you break out into, a traditional doctor's office, I know in the US how it is with our insurance system. In Canada, maybe a little bit different, but still they're under these constraints of, here's your month supply, maybe here's your 90-day supply. Here, that's what the insurance will cover. But when you're talking about generic, relatively cheap medications, someone who's been taking the same dose for the same condition for years and years, then yes, these people should be given access. They should to a year supply of medication that is affordable. To me, the more you think about it, you're just why has this not been done before? But that's why we're so excited about being able to offer that service.
I'm surprised that the government hasn't kind of got on board, and of course they're always late to the party. But in terms of ensuring some kind of they talk about the what is that called, the strategic oil reserve? But what about a strategic medication reserve?
So there is the strategic national stockpiles, the SNS, and they have a ton of medication for all kinds of scenarios. Where it gets tricky is how do you get that stockpiled medication into an individual's hands in a timely manner? Turns out that's really tough to do, especially if it was in a, for example, a bioterror attack. The antibiotics in our kit were specifically chosen to cover for the most likely bioterror events. So you're talking anthrax, plague, tularemia. Those medications, or I should say the anthrax, for example, if there were an anthrax attack that was aerosolized in your area, you've got less than 24 hours to begin treatment for prophylactic treatment with these antibiotics. So you're talking about potentially millions of people who all of a sudden need to be given this life-saving medication. Based on my past experiences and all of ours, maybe collectively in the last few years, we could see how that could quickly turn ugly. So that's the kind of mentality that we're trying to educate people about, so that they can be prepared, so that they can prepare their loved ones.
And one of my biggest questions is, when I get these antibiotics, you are provided a booklet that kind of goes over what particular medications you should use for what. A lot of people will still have questions about that. Where can people go to get more insights on what particular antibiotics they should be using for what particular thing? Especially based on everybody's different demographic, age, sex type thing. So maybe you can talk a bit about, the proper use of these antibiotics.
As much as we talk about how important and vital and life-saving they are, they're not without their side effects. They're great when they're used appropriately. And so that's the trick. How do I know when I'm using it appropriately? And that gets into some of this, the other question about, well, what about, we call it antibiotic stewardship in the medical industry. And that's basically only using antibiotics when they're appropriate for the appropriate condition and in the appropriate way. Not all infections are caused by bacteria. And if you have a viral infection, you can take as many antibiotics as you want. It's not going to do anything other than potentially hurt you because you're taking unnecessary medications. So part of the service, you mentioned the guidebook. So we include a guidebook. It's written in layman's terms. The idea is that our first preference is you have hopefully a family physician, a primary care physician, someone who knows you, who knows your health history. Our first preference is that in the event that for some reason you were actually going to use the medications in your Jasecase, that you reached out to that individual to tell them what's going on, get their expert medical opinion in your individual case. In the event that that's not possible for whatever reason, then you've got the guidebook as kind of your backup, where it's just you, right? And you've got to make this call yourself. And so it's written in a way specifically for the antibiotics that are included in the kit. It's not exhaustive. It's not all inclusive. We tried to cover the most common bacterial illnesses that you would see. You mentioned a lot of them. As you're out and about, maybe in a hurricane or a flooded area, you're doing hard work. You've got boards with nails exposed. You're getting scrapes. You're drinking bad water. Any of this kind of stuff. We wanted to include all of those different kinds of conditions, and then the ones that were really deadly, the biotear stuff. So you've got the guidebook for that. And then as a backup to everything, we offer our own services. The physician that reviews your case, reviews your health history, and actually writes the prescription for you. You're able to contact that physician, ask them, hey, whatever treatment specific questions you might have about the medications that you were prescribed. And so you've kind of got a good plan of action on how to safely use the medications. If you've got questions, people are taking other medications, they don't know if they might interact. So that's part of why these aren't just available on the shelf for anyone to grab. That's where you need to have a real prescription from a real doctor who's reviewed these things. And then we like to supply that extra, I guess, education with the guidebook, and then contact us anytime.
Yeah, and that's one thing I think, when people are assessing the price of this service, it's cheaper in the US than it is in Canada. We'll get to that, but it's the consultation, which I think is another part of it. In Canada, we get free healthcare, right? So that means that when I go and see a doctor, I don't have to pay anything. But I'm pretty sure in the States, when you go and see a doctor, in most places anyways, you actually have to pay, to see that doctor. So the consultation is combined with the price. So that's something to keep in mind, is that if you were to go and get this from your doctor, you would have to pay your doctor to see them on top of the cost of the medication itself. So maybe you can just give us like a price breakdown of what it costs in the States and Canada, and the reason for the pricing, I guess, if whatever you can share about that.
When it comes to pricing, that's something that we needed to align our mission with the pricing. Our mission is to empower everybody to be better prepared medically. And so we needed to find a price point that was going to be accessible to as many people as we could, while still allowing us to build the business and get the word out to everybody. And so the price we have, and you hit it right, you hit the nail on the head. You're not just walking into a Walmart or a Walgreens and buying some meds off the shelf. There's a lot more involved in getting these in your hands. And one of the biggest things is that physician consult. You've got to have these are licensed physicians who are reviewing your case, who are making determinations based on your answers. We have people with allergies to some meds, and so we were switching things out. So there's a consultation there, and sending it to a licensed pharmacy to then distribute, to mail out and distribute to your home. And then along with that, which we've already talked about, but is that ongoing service where you can reach back out, contact us, contact the physician with questions, the guidebook. So it's a whole service that you're getting. And we did our own studies early on and looked at, if someone was just to come in off the street, buy these medications at retail cost in a few different pharmacies, at least here in the United States, the range was anywhere from $500 to $700. If again, paying retail costs off the street. So we feel that $259, which is what our service costs here in the US, includes the 5 medications, the guidebook, the consultation, is actually a really good deal. Something that we were surprised about, frankly, is the price difference in Canada. That was something that came a little bit as a shock to us, because we just assumed, because everyone says that in the United States we pay the most for our healthcare, right? So here we are now going up into Canada, and we had awesome demand, just a flood of emails every day with Canadians asking for the service. So Canada got to the top of our list really quick, and we made a real effort to get up there as soon as we could. And we had to go through the same hurdles there as we did here, as far as finding physicians licensed in every province, and pharmacies that could ship the meds as well. And it just turned out that and I don't have a really good reason to this day. We're still trying to figure out why it is that generic medications in Canada cost more than they do in the US. But that is the price difference. It's simply the additional cost of the medication that we're paying for in Canada versus the same meds here in the US. So I get confused between the Canadian and the US conversion, but I want to say, It's 429 Canadian, I think. Shoot, we should probably look that up.
That'll be about 330 USD. So it's about $80 more.
Yep.
Yeah.
Yep.
Yeah. So it's not uncommon for us to pay more for stuff up here, but usually that's because it's, we have to get it shipped up here. But
hey, that's why it's crazy, because these meds are all coming from the same factories overseas, and they're going through the same wholesalers. And so I don't know if that has something to do with the deals with, government and socialized. I don't know what you guys call your health system. What do you call your?
They call it I guess you guys call it universal healthcare, but I'm not
universal
sure.
Healthcare.
Yeah. So
so it's 435 Canadian, just so we have that clear. 435.95.
So it is available now in Canada. For the first little while, it wasn't available. Now it's available. So I would encourage people to go through the link in the description and pick up a case of Jase Medical. And I would say, with respect to the price point, I mean, you can't really put a price on life, especially if it's, I got kids, and kids are going to get scraped up. Kids are going to get sick, and if we're talking about, grid down, I mean, there's people who would be willing to pay thousands of dollars for that. So even in a, and this is nothing I would ever encourage people to do, but, because obviously if it's prescribed to you, it's prescribed to you. But let's say you're in a community of people and, it's a zombie apocalypse. Obviously we're not being literal when we say that, but you know what I mean? And, and you have something that they could potentially use, it'd be great for you to be able to provide that to them, in their time of need. And you just can't put a price on it, really. And I understand that people have to prioritize and budget certain things. This is not like the first thing I would suggest people run out and buy if you're just getting into preparedness. But I would definitely say, if you have all your, your boxes checked with respect to food, your basic medication, your first aid supplies, your water, and all the other stuff that goes with prepping, then this is the next step. This is a no-brainer, in my personal opinion. And the price point is good. I think it's not bad at all. Especially, a lot of people will say, there's comparable veterinary supplements, which are obviously suspect in terms of, where they originate and how they're made and manufactured. But I would still say, even like the prices on those things, and I don't want to say them, otherwise this video will be flagged, but the prices on those things are just as much now, if not more expensive, because you get 5 different types of antibiotics, and all of them in the Jasecase, and all of them have enough to run like one course of treatment. Is that how it works?
Yeah, right. So the intent was a supply for one adult to be well supplied for any eventuality within a year's period of time. So the full course for a biotear, full course for UTI, skin infections, sinusitis, pneumonia. Now, if you had all of those at once, you might run out of meds, but that's the idea. And these meds, the intent was for one adult for 1 year. But the actual expiration date is a common question that we get on these medications. And It turns out, we absolutely recommend officially that you follow the manufacturer's stated expiration date. And those turn out to be usually around 1 to 2 years from the time you get your meds. You'll see it there. We mentioned before the strategic national stockpile. So the government has these big stockpiles of meds, and they were having to turn them over, every year. And it was very expensive. And so they actually commissioned a study called the Shelf Life Extension Program. It's still ongoing today. It's done through the FDA and the Department of Defense here in the United States. What they found was that the hard medications, like the pills that you swallow, the antibiotics that we have in the kit, on average retained all their potency on average for 5 years, with many of them many years beyond that. So that's good information to know. Again, officially, we recommend you follow that manufacturer's expiration date. But through those, they're well-published studies. You can look them up online. You can see the individual, how long each of these meds retained their potency. And it's really interesting stuff. We have that information on the site. We get that question all the time because it is, while we feel this is a really accessible cost price, it can be a lot, especially for a family when you've got, mom, dad, maybe a couple older children. It's a significant investment. And so knowing really how long that your medications can, as long as they're stored properly, in a humid, free, dry, warm, not too warm, not too cold, but just kind of a room temperature environment, then your meds can actually last for quite a while.
Yeah, and I think some of the estimates in that study for some medications were like 20 years past expiration.
Yeah. It was really, really, it's a fascinating study, all the information they found. But yes, many 15 plus years, 20 years. Yeah.
And they would retain maybe not all of their potency, but some of it.
Right. It's usually like 90% of their potency, which, in the antibiotic world, if it was my loved one or myself, and I personally would be okay with doing that if the circumstances warranted.
Absolutely. So I think that this is just a great service, and people should get it while the getting's good, because like the supply chain right now is pretty screwy, and we don't know what's coming on the horizon, especially with respect to what is going on in Eastern Europe, what is going on in China right now with the pandemic, which is spreading again there, which is going to be causing some issues. And there's just a big potential right now for countries who do have these trade relations, for those to be compromised in some way, shape, or form. And as a result of that, we might see rising prices. We might see delays in the supply chain. So this price point right now might seem really, appetizing, in a year's time, because, the prices could potentially go up significantly. So, I just, and I'm seeing that across the map. I've been, kind of beating that drum for a while, where every 2 or 3 months, I'm getting messages from my suppliers, because I have a store, CanadianPreparedness.com, and we sell all kinds of like emergency equipment. And every single manufacturer every few months is raising their prices. It's getting to the point where it's kind of getting scary, because these price increases far exceed what we're being told about inflation. So,
Yeah, very true. It's ironic that we're in the supply, we're kind of highlighting the supply chain issues in the pharmaceutical industry. And then of course, the more success we see, the more supply chain issues we have to deal with, whether it's securing enough medications. A few weeks ago, there was a nationwide shortage of ciprofloxacin that's included in our kit. So dealing with those issues, we already see them and are dealing with them. And then, we include our book, we include our case. That's a whole nother supply chain issue that we've been trying to get ahead of. But at the end of the day, we feel strongly that it's not if, it's when. And so, we had this internal discussion of, hey, we're having a hard time, cases and books. Maybe we should hold off on shipping out orders. And it was like, no, not at all. Because what people need is the medications. If we can get the medications, then let's press forward. We'll get them their case. We'll get them their book as soon as we can. But what they need are these medications. And so we're full steam ahead and working hard to get everyone prepared.
Mm-hmm. And maybe just lastly, what can a person expect with the process? I mean, I kind of broke it down, but it was about a month and maybe 2 months ago that I got my Jasecase. And I remember it being a fairly friction-free process. Maybe if you could just quickly walk people through what it looks like from start to finish, from going to the website to actually getting the stuff in the mail.
Totally. So it is as simple as we could make it. We wanted to make it as easy and simple as we could. So you go onto the website. There's a number of different buttons that'll say, take me to my consult or start your order. That opens up what is your kind of virtual consultation. It's a series of questions. We get basic information, obviously name, date of birth, address, that kind of stuff. And then we get just the pertinent health information that we need in order for our physicians to be able to safely write the prescriptions. And so they need to know, what medications are you taking? Are you allergic to any of the specific medications we're prescribing? Just a little bit about your health history. We like to know that you have some kind of regular primary care follow-up. You answer those questions, upload a photo of your ID, pay the fee, and then that goes to our physicians, who then will actually process the encounter. If they have any questions, sometimes they do, not very often. We try to to make the form, really get all the information that they need. But in the event that they have a question, then they may reach out via text or email to make a clarifying question. But for the most part, that's not needed. They will take that information. They'll go ahead and write the prescription. That gets sent to one of our pharmacies. We've got a number of pharmacies here in the U.S. and a couple up in Canada who are able to ship medication to all 50 states or all 10 provinces, and that just gets shipped out. Usually, the whole process, from the time you fill out your form to actually have medications in hand, I would say given shipping times, they vary depending on where it's shipping from and where your home is, but beginning to end is about a week, sometimes even a little bit faster than that. But again, simple, straightforward, pretty painless process.
It's not like they're asking you questions which are invading your privacy in any way. And I just found it to be incredibly quick and painless. I thought it was going to be more of a process, where I had to, they're going to ask me all these questions and they're going to maybe decide or find any way that they could to reject, my order. But no, it was fairly straightforward, but they are thorough, so that, like you said, I can't remember what you referred to it as, but it's the stewardship with respect to the administrating of these medications. They do take that seriously. So I think that's a great thing and a testament to the integrity of the program itself. So I would strongly encourage people, go get it while you can, because you're saying 1 week. Right now, it's only a matter of time, I think, before we start seeing more delays. We got COVID back in the news again. That could potentially create worker shortages, which is going to lead to delays. So I would encourage people to go and capitalize on it while they can. And because you're already kind of priced in the best price you can offer, unfortunately, as far as I know anyways, there's no more deals, like there's no discounts or anything, because they're already giving it to you guys at the best price they can possibly give it as. I think when we first started, we had a brief discount. I don't know, has that changed at all? Or
as we've had more of these specials and trying to just get orders through the door, it's come down to just where, in order for us to really, as we're trying to bring on chronic meds and do other things, we've got it aggressively priced. We feel that it's a great value, and that's where we plan on having it stay for the future.
And I think too, a lot of companies will use the discounts as kind of a gimmick, to kind of get people to buy it. But
right, where you mark it up and then discount it.
Exactly. Yeah. And you guys aren't doing that. You're giving the best possible price you can. And I know, because I've tried to negotiate with you to get my subscribers a discount. You've provided the reasons why, like, look, we're just on really slim margins here. And, it's important for people to know that, I think, because people might just suspect, like, these guys are, making huge amounts of money off this. But, you're just basically making what you need to make in order to grow the business, to get this stuff into
right.
And so
exactly. I mean, kind of like, and like I said earlier, we're new, kind of new in this industry, and needing to secure these supply chains so that we can ensure that we can continue to do this for people down the road. As we're ordering more and more, as our pharmacy partners are ordering more and more medications. So there's a cost to all that. And at the end of the day, it comes down to us just doing everything we can to fulfill this mission.
And I don't want to know what your insurance bill is. We're just going to leave it at that. All right. Yeah. So any final thoughts on preparedness, any final prepping tips? Would you be interested in coming back at some point if people had questions in the comment section? Maybe I'll ask my subscribers, post your questions in the comment section, then maybe we'll get them back on here. And just, do you have any general preparedness advice, wise words of wisdom that people can keep with them in hard times?
I mean, I think for me, just kind of keeping it, I guess in keeping it in my wheelhouse here of medication preparedness when it comes to your medical preparedness, I should say. It's just one of those things. We always try and come up with scenarios when we think we might need this, and looking around the world, around what's going on in the world around us. there's no shortage of scenarios, whether it's geopolitical stuff, whether it's natural disasters, any number of things. And it's not a fear mongering thing. It's not trying to make everyone, run around afraid of, like a Chicken Little thing, the sky is falling. It's prudent preparedness. And it's something that thankfully, I think as we've kind of come out on the other side so far of this pandemic, that is much more maybe normalized than it was before. And I think that's a great thing. So, we're here trying to do our part. I know your viewers are passionate about the whole world of preparedness. And so I just commend everyone for being, for being here, because they're educating themselves. They're learning things that a lot of people didn't know, that I didn't know in the profession, a couple of years ago. And I think as we get this knowledge out there, it will do a lot to potentially save a lot of lives in the future. So I just really appreciate the opportunity.
Right on. Prudent preparedness, guys. That's what this is. This is common sense based. It's not about, preparing always for the apocalypse or anything like that. It's just, things can happen, and they're going to keep happening, unfortunately. So you can be prepared for it by getting yourself some Jasecase. So go check it out. Thanks for coming on the program, Dr. Rowland, and maybe we'll have you back if there's enough questions.
Would love it. Yeah, I would love it. Yeah, let's do a Q&A. I'm all about it.
All right. Take care.
Thanks.
The best way to support this channel is to support yourself by gearing up at CanadianPreparedness.com, where you'll find high-quality survival gear at the best prices, no junk, and no gimmicks. Use discount code PREPPINGGEAR for 10% off. Don't forget, the strong survive, but the prepared thrive. Stay safe.